Are you a physical therapist interested in cash-based physical therapy? Or are you a new startup interested in learning what does that first year look like? What lies ahead and what struggles am I going to encounter? If you are, this video is perfect for you. My name is Dr. Garcia. I'm a cash-based physical therapist. I've grown my company into 3 locations and more than 15 staff. And I'm here to help cash-based physical therapists just like yourself become successful and be that #1 expert inside your town. When you look at that first year of cash-based physical therapy, most people go wrong because they apply what they learned in PT school, but also what they might have learned in that traditional mill-like setting where you're heavily focused on impairments, you're heavily focused on numbers and metrics to prove to an insurance company and justify why you're needed. Now, when you change that model to cash-based, that expectation changes. That patient no longer cares about 5 degrees of range of motion. They care about, what does this do for me? And the biggest difference physical therapists fight inside that first year is this blend where they learn what they were taught initially, and now they have to blend that with what a patient needs and wants. And that battle's really tough because you've been to the perspective of, how do I help this person get better so the insurance reimburses us at the right rate, but also that that patient can continue to come back for 12 visits. In a cash-based model, you're trying to help that person get better, faster, get back to the things that they love. And so range of motion and those things are important, but ultimately it comes down to, have you been able to hike more? Have you been able to run more? How much longer could you stand without pain? It is truly about functional limitations and no longer about skill development. Now, where PTs will struggle is they will continue to take CEU courses. They'll take 5, 6, 7 CEU courses, hoping that those clinical skills will improve patients' outcomes. And I know that sounds, counterintuitive, that that should be able to make sense. However, the struggle is improving knee tibial femoral rotation, improving ankle dorsiflexion. Those are all very important because those are what you needed to justify range of motion improvements. But how does that translate to them being able to squat? So what they want to do is they want to be able to train in the gym 5 times a week. They want to run that marathon. So while you're learning clinical skills to improve knee range of motion, they're looking for, well, how does that improve my life? And where physical therapists struggle is they think CEU courses and just pure clinical skill development is going to be the answer. And that actually is not true. It's actually the opposite. You really need to focus a little bit more on people management, creating expectations and managing people's expectations. You have to then explain to the patient on a regular basis, I understand that you want to be able to squat pain-free in 2 weeks. However, that is going to be difficult given your soft tissue healing timeline and all the impairments that we found. We're going to work up to managing your hip, your knee, your ankle, your shoulders. Plus, we're also going to be working on your strength and conditioning program and also your flexibility, so that way, when you're finished with physical therapy and you're out of pain, that you can continue these things. And now that is where PTs struggle. It's that conversation of being able to manage somebody's expectations. It's not as easy as, well, your hip is stiff, your posterior capsule is limited, you're limiting your knee valgus, you now need ankle dorsiflexion. Those things don't resonate and the patient doesn't understand that. So what happens is there's poor communication. That patient is so lost because you're used to using PT jargon inside an insurance-based practice. You're now speaking to the insurance, you're speaking to the physician, you're speaking to the physical therapist. But now you're transitioning into speaking to the patient in layman's terms, because now you're that main provider. And that's where PTs struggle. They weren't the main healthcare provider in the past. They didn't know how to talk to that person and manage expectations, yet they waste their time and focus on more clinical skill development, more CEUs, because if I learn more skills, I can improve outcomes, and that's when people are going to want to come back. And that's not where they come back. They come back because you understand them. And that is what's going to set you up for success. Now, what does failure look like? Clinicians will go inside a cash-based practice. They'll use that same traditional model, develop all the clinical skills, explain to people why things are stiff, loose, whatever that is, and that patient doesn't understand, so they don't keep coming back. So while this PT is doing community events, they go to CrossFit gyms, they go to marathons, they go on Instagram, they do all these things, that patient doesn't come back, and now they're a wheel of all new patients, and that gets exhausting. So where PT struggle is, they might be doing side hours of home health, they might be doing other things, and they find this struggle where they can't blend going all in into a cash-based model, and it's not because of clinical skills, and they start questioning, am I good enough? Is this a thing for me? And it's not your clinical skills, that you just don't understand where you're struggling and where you need to put your focus. Now, the things I can tell you is improve your communication, understand and manage people's expectations, build that relationship with that patient while you refine your clinical skills. But not all your attention needs to go in clinical skill development, because that's what PT school taught you. That's what the traditional model taught you. This is going to set you up for success in that first year, so you don't feel like, am I good enough? Is this the right thing? Did I get in the wrong choice here? Was this a thing I should have done? And you'll constantly question yourself. There's going to be hundreds of physical therapists right behind you doing that same thing, but now you're going to be set up for success and onto your way to a successful cash-based practice.